Centers for Disease Control is defending its decision to ease mask-wearing guidelines for fully vaccinated people. They say political pressure had nothing to do with the abrupt shift in guidelines last Friday. Critics say the decision was a surprise and was communicated poorly. Joining us now is Dr. Tom McGovern, co-host of the Dr. EWTN radio show and podcast. Dr. McGovern, welcome back. Great to be with you. First off, your thoughts on this new guidance from the CDC when it comes to mask wearing. It seems it took a lot of people by surprise and seems to be causing more questions than answers right now. Your thoughts?
I think it's long overdue. Basically, they're saying the vaccines work. So if we're vaccinated, we're really not putting people at increased risk of disease. In my practice, we had a conversation among all of us partners on Friday. And as of today, if we've been vaccinated, we don't have to wear a mask at work anymore. My patients got to see my smile for the first time in 14 months today, and it was wonderful.
That is so great. I know we are missing that so much. So do you think that this decision means that we're nearing herd immunity and the end of the pandemic and a return to normal is imminent?
I think we're closer. I think it's all a continuum. I don't think there's a black and white difference. I think there will be what some public health doctors refer to as a tipping point coming. We are close to it, but not quite there. I understand they've passed that tipping point in Israel, where the rate of disease is incredibly low there. I think we need to get more people vaccinated to quite get there, but we are definitely closer. I think what caught people by surprise is that it seems like such an abrupt change instead of a more phased in change. And that may well be what many people are reacting to.
Yeah. And do you know, what, if anything, does this decision mean for houses of worship?
It's funny you asked that. I got the update from the CDC within minutes, first from my friends in public health that we've had on the show, Dr., and then from our director of liturgy in the diocese, where I've been acting as a consultant. And by the end of the day Friday, we had written down that pastors could make their own decisions about masks or not. For instance, my parish, my pastor is still uncomfortable releasing anything, but in another one down the road, they're letting people who are vaccinated not wear masks at church. So I think we're practicing subsidiarity now, and it means that churches, depending on what their bishops say, now have the right to ease off. And I think many churches around the country have seen that gradual easing off on restrictions, which I think gives increased hope. I saw more people in my parish yesterday than I've seen in 14 months, and it was a wonderful thing to behold.
Wow, absolutely. As you know, also the FDA just recently greenlighted the Pfizer vaccine for children 12 to 15. However, it's still only approved for experimental use. When do you think we'll see the FDA fully approve the vaccine, and how long does that process normally take?
Well, normally we see this take years. I think they're going to get it down to months or weeks with the way that this is going, because I know many hospital systems are considering requiring it for their employees, but they don't really want to require it while it has an emergency use authorization category. I think it will be sooner than later. I wouldn't be surprised if it's sometimes this summer. I don't have a crystal ball. I was actually surprised it took as long as it did to approve for use in 12 to 15-year-olds. Since the data came out March 31st, I thought it was only going to take a week or two like it did in December. But thankfully, my 15-year-old twin sons now receive their first dose, and I'm very happy about that.
That's great. That's so good to hear. Before we let you go, any final thoughts when it comes to the mask wearing or the vaccines, things that we should know?
We've seen the vaccine received by tens of millions of people with rare side effects, and there are virtually no side effects that turn up after 6 weeks post-vaccination. So I think people can be confident that they work, especially the mRNA vaccines, which don't even have the rare blood clotting side effects. Masks do make a difference, but they really don't make much of a difference once you've received the vaccine. So if you're on the fence, get the vaccine. It means more freedom. And those of us who've been vaccinated are enjoying that freedom.
Oh, that's so great to hear. And thank you so much for joining us today. We really appreciate having you on in your analysis. Dr. Tom McGovern, co-host of the Dr. EWTN radio show and podcast. Thank you again.
Thank you.